Hello, good morning. Myself Dr Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the wrist and hand complex biomechanics, in which we'll discuss about mid-carpal joint structure. So mid-carpal joint is the articulation between the proximal and distal row of the carpals. So it is the articulation between scaphoid, lunate and triquetrum proximally and trapezium, trapezoid, capitate and hamate distally. Functional unit rather than an anatomical unit. It has separate fibrous capsule and synovial lining that is continuous with each intercarpal articulation and some with carpo-metacarpal joint. It is a complex. It has overall reciprocally concavo-convex configuration. It is functionally distal carpal rows moves as a fixed point, and the union of distal carpals also result in equal distribution of load across scaphoid, trapezium, trapezoid, scaphoid to capitate, lunate to capitate and triquetrum to hamate articulation. Distal row contributes to 2 degrees of freedom to wrist complex with varying amount of ulnar and radial deviation and wrist flexion and extension. And the distal carpal row leads to the foundation of transverse and longitudinal arches of the hand. Next is the radiocarpal capsule and ligament. Radiocarpal capsule ligament has a strong but somewhere loose capsule and reinforced by capsular and intracapsular ligament. Most ligaments and muscles crossing radiocarpal joint also contributes to mid-carpal joint stability. Next are the ligaments of the wrist complex. The ligament of the wrist complex are designed either extrinsic or intrinsic. Extrinsic ligament are those that connects the carpals to the radius and ulna proximally or to the metacarpals distally. Intrinsic ligament are those that interconnect the carpals themselves and also known as intercarpal or interosseous ligament. So it is a difference between the extrinsic ligament and intrinsic ligament. First is the connection. Extrinsic ligament are connected between the carpals to radius ulna proximally and metacarpal distally. And intrinsic ligament interconnects carpals, or which is also known as intercarpals or interosseous ligament. Intrinsic ligament are stronger and less stiff, and they lie within synovial lining of the joint. Next is nutrition. Extrinsic ligament is by through contagious vascularized tissue, intrinsic ligament by through synovial fluid. The risk of injury is high in the extrinsic ligament and low in the intrinsic ligament. And if after injury, extrinsic ligament has healing fast, and there is a slow healing in the intrinsic ligament, or extrinsic ligament accept force is first in the wrist complex. Thank you.